Hello, my name is Kimberly Larson, and I'd like to talk to you about prescription drug overdoses, specifically pertaining to opioid abuse. Every day in the United States, nearly 80 people die due to opioid overdose. This powerful, highly addictive drug is prescribed to patients for something as minor as tooth extraction or back pain. For this reason, it is crucial that policies be put into action to address this growing epidemic. Why we should talk about opioid abuse as a policy-relevant problem. The current leading cause of accidental death in the United States is accidental drug overdose, surpassing peak annual deaths caused by motor vehicle accidents, guns, and HIV infection. Why is this important? It's important because this epidemic is avoidable. Who is it important to? Every person of every age is susceptible to opioid abuse or overdose. People go to doctors for a myriad of reasons. If a drug is prescribed, it will likely be taken because it came from a trusted doctor. The problem is, once the drug is prescribed and in the patient's hands, there is no way to monitor how and what amounts it is ingested. The result is, from 2003 to 2015, prescriptions for opioids began to soar and rates of addiction and overdose deaths increased in parallel. Because opioids are prescribed for the care of minor discomfort, opioids are more likely to harm patients than help them because the risks of addiction outweigh any potential benefit. Additionally, opioids have not been proven effective for daily long-term use. Evidence suggests that chronic use of opioids can even make pain worse, a phenomenon called hyperalgesia. Hyperalgesia is a medical condition caused from the overuse and chronic use of opioid medication or drug use. This condition creates an increased sensitivity to pain which may be caused by damage to the nerves. Who should be concerned? According to the Surgeon General's report on alcohol, drugs, and health, misuse of prescription opioids can begin at any age and continue to be a problem across the lifespan. These are people without the predisposition to substance abuse disorders. In an effort to address this opioid abuse problem, the Office of National Drug Control Policy, or the ONDCP, was enacted. The ONDCP works to reduce drug use and its consequences by leading and coordinating the development, implementation, and assessment of U.S. drug policy. In addition to its vital ongoing work, the ONDCP also provides administrative and financial support to the President's Commission on Combating Drug Addiction in the Opioid Crisis, which was established by executive order on March 29, 2017 by President Trump. This is a step in the right direction, but much more needs to be done to address this prevalent issue. This problem is not going to go away on its own. Addiction to and the potential overdose from opioids can happen to any person of any age within any socioeconomical standing. For this reason, policy needs to be enacted to prevent the abuse of prescription opioids. Until opioids are prescribed more cautiously and until effective opioid addiction treatment becomes easier to access, overdose deaths will likely remain at record-level highs. I thank you for your time, and I urge policymakers to evaluate options to address this preventable crisis. Thank you.